Are the new blockbuster weight loss drugs safe if you have multiple sclerosis, MS? That is the big question on many minds, and getting a straight answer can feel like a real challenge. I am here to be direct. I will be clear. I will even sprinkle in a touch of humor because, let's face it, sometimes you have to laugh to keep from crying. But before we dive deep into the science and safety, a medical disclaimer. The information presented is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician regarding a medical condition or treatment. Never disregard professional advice because of something you have heard here. Medication decisions should only be made with your licensed healthcare provider. The answer is not found in a headline, but in a conversation. Now let me give you the short answer right up front. Maybe. For many, the answer could be a cautious yes, but for others, it is more complicated. The truth, as it so often is in medicine, truly depends on you, your specific MS journey, and a very careful conversation with your medical team. Let's not dance around the names. You have heard of them: Ozempic, Wegovy, Mounjaro. These are not old-school diet pills. They belong to a class of drugs known as GLP-1 receptor agonists, originally developed for managing type 2 diabetes. Their powerful effect on weight loss has made them famous worldwide. These drugs work by mimicking a natural hormone your gut produces called glucagon-like peptide 1. This hormone has a few very important jobs that contribute to weight management and blood sugar control. It reduces appetite. It tells your stomach to slow emptying. It helps prevent rapid blood sugar spikes that lead to cravings. Imagine this GLP-1 hormone as a traffic controller for your digestive system. Show gut-brain axis diagram with arrow from the stomach to the brain, labeled GLP-1 hormone signal, I'm full. When you eat, your gut releases it and it sends a signal directly to your brain's control center, telling it that you are becoming full. The end result is a powerful, multi-pronged approach to reducing hunger and caloric intake. The popularity of these drugs is rooted in their proven effectiveness. For many individuals struggling with obesity, these medications have been life-changing. In key studies, people lost on average 15% or more of body weight. For someone at 200 pounds, that's about 30 pounds. It's a powerful tool in the medical arsenal. From a safety perspective, these drugs have a well-documented profile for the general population. The most common side effects are gastrointestinal, nausea, constipation, diarrhea, mild stomach discomfort. These often happen when people start or the dose is increased. For most, side effects are temporary and improve within a few weeks as the body adjusts. But the world of MS is unique. It comes with its own set of rules, its own risks, its own specific treatments. Multiple sclerosis is a complex autoimmune disease where the immune system attacks the central nervous system. People living with MS often take powerful disease-modifying therapies, DMTs, designed to modulate or suppress parts of the immune system. First question: GLP-1 can influence immune cells. How does that interact with specialized MS medications? Good news. No strong human evidence shows GLP-1s trigger MS relapse or speed progression, but the data is extremely limited. Some lab work hints at anti-inflammatory effects, promising in theory, not proof in people on specific DMTs. Second, infections and wound healing. Immunosuppressive MS meds can raise infection risk. GLP-1s slow stomach emptying, gastroparesis, causing nausea or vomiting. Poor intake can weaken defenses. Third, drug absorption. Slower gastric emptying could change timing or amount of oral MS drug absorbed. The honest answer: we don't know for sure. Careful neurologist monitoring is required. During relapses, high-dose steroids like Medrol can spike appetite, fluids, and blood sugar. GLP-1s might help but require close supervision. Bring these to your visit. 1. Will this GLP-1 interact with my specific MS DMT? Name it. 2. Does my MS drug raise infection risk? And how will we monitor me on GLP-1s? 3. What's our side effect plan and follow-up schedule, including labs? 4. If I need a steroid course, what's our plan for managing both medications together? And 5. What are our goals? Weight loss, blood sugar, or both? And how will we measure success? Red flags to stop and call your doctor. Severe persistent abdominal pain with vomiting, pancreatitis, high fever, chills, or feeling profoundly unwell. If this calm, clear discussion helped, please like the video and subscribe. It helps others with MS find these answers. Now the big reveal. Are GLP-1 drugs like Ozempic, Wegovy, and Mounjaro safe for people with MS? The most honest, medically responsible answer: there is no universal yes or no. For many with stable MS not on heavy immunosuppression, these can be safe and effective with careful supervision. For others, interactions, steroid timing, or health factors may tip risks over benefits. Proceed with caution, start low and increase slowly, and keep an open line with your medical team. A simple symptom diary helps track progress and flag issues early. In case you missed it earlier, here's the medical disclaimer again. The information presented is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician regarding a medical condition or treatment. Never disregard professional advice because of something you have heard here. Medication decisions should only be made with your licensed healthcare provider. The answer is not found in a headline, but in a conversation.